On January 1st, 2026, Nancy Linder's health insurance premium jumped from $162 a month to $483 a month. She did not change plans, nothing about her changed. A single deadline in Washington had passed. That same deadline just doubled premiums for over 20 million Americans. The subsidy that kept their costs down is gone, and what is unfolding now is something Congress was warned about for years. In March 2021, Congress passed the American Rescue Plan Act. Buried in the bill was a simple promise. For the next 2 years, no one buying their own health insurance on the Affordable Care Act exchanges would pay more than 8.5% of their household income for a benchmark silver plan. For the first time, middle-class families and older adults could get real help, even if their income was above the old cutoff. The subsidy cliff was gone. $0 premiums became available to those earning less than about $20,000 a year. For millions of freelancers, small business owners, and early retirees, the math changed overnight. But the law was temporary by design. The enhanced subsidies were set to expire at the end of 2022. In August 2022, the Inflation Reduction Act extended them, but only through December 31st, 2025. The deadline was written into the statute. Every renewal notice, every rate filing, every insurer knew the date, January 1st, 2026. There was no surprise. The government spelled out exactly when the help would end. Congress had years to act, and warnings piled up from consumer groups and insurers alike. Yet the extension never came. The cap vanished as scheduled. For anyone who depended on those enhanced credits, the expiration was not a technicality. It was a hard stop. Premiums were uncapped again, and the old rules snapped back into place. The relief that held the market together for 4 years was always meant to be temporary. When the clock ran out, families like Nancy Linder's found themselves on the wrong side of a deadline they could not control. The numbers landed like a punch. On January 1st, 2026, health insurance premiums for more than 20 million Americans who rely on the Affordable Care Act marketplace did not just rise, they doubled. According to a national analysis by the Kaiser Family Foundation, the average annual premium for subsidized enrollees jumped from $888 in 2025 to $1,904 in 2026. That is a 114% increase, or $1,016 more out of pocket for the exact same coverage. For a self-employed consultant in Ohio, that meant a bill that had been $74 a month was suddenly $158. For a social worker in Texas, the premium shot from $85 to nearly $750 a month, almost an entire week's pay gone in a single bill. The Kaiser Family Foundation analysis used federal enrollment data and insurer filings to track what happened when the enhanced tax credits disappeared. The math was simple but brutal. While the enhanced subsidies were in place, no one paid more than 8.5% of their income for a benchmark silver plan. When the cap vanished, premiums snapped back to their old rules. For some, the increase was hundreds of dollars a month. For others, it was the difference between keeping coverage and dropping it entirely. This was not just a line on a spreadsheet. It was groceries, rent, and savings wiped out by a single policy deadline. A cancer survivor in Florida saw her premium hit $700 a month. An Atlanta couple's bill tripled overnight. For millions, the numbers were not theoretical. They were the new reality, with no warning and no escape. That is what the end of the enhanced subsidies looked like in real life, a price shock that forced impossible choices in kitchens and living rooms across the country. Nancy Linder opened her renewal notice and stared at the number. Last year, she and her husband paid $162 a month for their health insurance. On January 1st, the bill jumped to $483. Their plan had not changed, their doctors had not changed. Only the subsidy was gone. The Linders run a small landscaping business outside Atlanta. Their income is steady but not high. With the new premium, health insurance now costs more than their monthly grocery budget. Nancy started skipping her blood pressure medication to make the numbers work. She is not alone. Hunt, a cancer survivor in Florida, saw his premium climb to $700 a month. Before the subsidy expired, he paid less than $300. The difference is nearly half of his Social Security check. Hunt has already cut back on groceries and canceled his gym membership. He is considering dropping coverage entirely, but he worries what a single hospital visit would mean for his family. Stan Clausen freelances in Salt Lake City. His premium rose from $350 to $500 overnight. That is $1,800 more a year, just to keep the same coverage. Stan's clients pay him by the project. Some months are good, others are lean. Now he is looking at cheaper plans with higher deductibles, but the risk scares him. One emergency could wipe out his savings. Robin Wright Pierce in Cincinnati faced a similar choice. Her premium doubled. She dropped coverage altogether. Robin earns too much for Medicaid, but not enough to absorb a $450 monthly hit. She is hoping nothing goes wrong before she turns 65 and qualifies for Medicare. For families like these, the expiration of enhanced subsidies was not a policy debate. It was a bill in the mailbox. The numbers are real. The trade-offs are immediate. Food, medicine, and rent now compete with health insurance for every dollar. Multiply these stories by 20 million, and the scale of the crisis comes into focus. Health insurance bought on the individual market is not just for one kind of person. It covers a patchwork of Americans: self-employed consultants, gig workers, small business owners, farmers, and early retirees. These are people who do not get coverage at work and do not qualify for Medicaid or Medicare. For them, the Affordable Care Act marketplace is the only option. In 2025, more than 20 million people relied on it. The majority are in their 40s, 50s, and early 60s, an age when premiums are already higher. A 60-year-old pays up to 3 times more than a 21-year-old for the same plan. When the enhanced subsidies expired, the math changed instantly. The system draws a hard line at 400% of the federal poverty level, about $58,000 a year for a single person, and $120,000 for a family of 4. If you earn $1 over that line, you lose all federal help. This is known as the subsidy cliff. For those just above the cutoff, premiums jump by thousands overnight. A 40-year-old making $50,000 saw their annual premium rise by about $2,000. For a family of 4, at $85,000, the bill nearly doubled. The exposure is not evenly spread. Affordable Care Act enrollment surged by 88% between 2020 and 2025 in states that voted for Trump in 2024, where employer coverage is less common and more people buy their own insurance. Middle-income households and older adults are hit hardest. They earn too much for Medicaid, but not enough to absorb a $400 or $500 monthly shock. The subsidy cap was a lifeline. Its disappearance left millions standing on the wrong side of an income line they cannot control. No matter how careful you are, you cannot budget around a cliff. The system is designed to leave some people behind. Congress had the numbers in front of them. The Congressional Budget Office warned that letting the enhanced subsidies expire would push 2.2 million Americans off their health coverage in 2026 alone. The House took up a 3-year extension, but the bill failed by just 6 votes. In the Senate, a Republican-backed alternative focused on health savings accounts never made it to the floor. The final session before the holiday recess ended with no deal. Budget analysts at the Congressional Budget Office and independent groups projected enrollment would fall by millions, and premiums would spike for those who remained. The market waited, but the policy vacuum was real. The fallout was immediate. By March, nearly 4 in 10 people who bought their own insurance had either switched to cheaper plans or dropped coverage altogether. Survey data showed that 9% were at risk of losing coverage partway through the year, unable to keep up with the new bills. The Urban Institute projected that 4.8 million Americans would lose their health insurance in 2026 alone. Insurers warned of adverse selection. When healthier people drop out, those who stay are sicker and costlier, pushing premiums even higher for everyone left. For more than 20 million Americans, the safety net had frayed. The spiral was underway and no one knew where it would stop. Right now, a cancer survivor pays $700 a month just to stay covered. For 20 million Americans, a single missed deadline in Congress means the math no longer works. This isn't politics, it's groceries, medicine, and rent. The real cost of inaction shows up in every household budget. Share your story below.